how to differentiate between the functional constipation and Hirschsprung disease. The more than 2 defecations per week in a 4-year-old child is more with 1 incontinent episode per week and retentive posturing, excessive volitional stool retention, painful hard stool, and large fecal mass with maybe at times distending your stool, obstructing the toilet. They are all diagnostic for your functional constipation in children with chronic abdominal pain. So, how to differentiate this clinical situation from really a grave disease or an important disease like Hirschsprung's disease? Hirschsprung's usually starts in the at birth, and your functional constipation usually after 2 years, more common after 4 years, and you have the encopresis, your involuntary passage of stool. It's more with your functional bowel disease or functional constipation. With abdominal pain syndrome, failure to thrive is more common with the Hirschsprung disease. Enterocolitis is more common with the Hirschsprung disease, and your abdominal distension is more common with the Hirschsprung, not with the functional. Usually, the PR, if you do the parectal examination, the DRE, whatever you call it, you will find empty, rectum or colon in the case of the Hirschsprung disease. And in your functional constipation, you will find stool mass, big lump. Biopsy in Hirschsprung's diagnosis revealing aganglionic segments. BSMMU, you have transitory zone in your Hirschsprung disease. So, if you do the parectal manometry, there will be delayed evacuation more than 24 hours in the Hirschsprung disease. So, it is to be differentiated because one treatment of the Hirschsprung is obviously a surgery, and thereby it's important to differentiate between the functional constipation, and their modality of treatment are different. The Hirschsprung is how do you treat the functional constipation? You give laxative, you ensure the daily bowel evacuation, you give something your around the anus, maybe a pile, ointment, something, and your change of the diet to fibrous diet.